Okay, well, hello and welcome everyone to this scholarship information session for Artificial Intelligence for Public Health. My name is Sarah Nyani and I'm the Program Manager for AI for Public Health. Before we begin, I would like to acknowledge that the land upon which this session is being hosted at the University of Toronto has for thousands of years been the traditional land of the Huron-Wendat, the Seneca and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. I'd also like you to know that all the information that we're sharing with you today in this session can be found on our website, and the web address is AI4PH-HRTP.ca. So the format today is we're going to begin with an introduction to the Health Research Training Platform, the entire program. Then we'll go on and look at the scholarship program. We'll look at this year's scholars, and then finally we'll open up the floor for some questions. So first of all, I'd like to introduce you to our principal investigators for the program. We have Dr. Lisa Lix from the University of Manitoba. Her research expertise lies in statistical methods for complex healthcare data and patient-reported outcome measures. We have Dr. Laura Rosella, who is our nominated principal investigator. Laura Rosella is an associate professor in the Dalla Lana School of Public Health, University of Toronto, where she holds the Canada Research Chair in Population Health Analytics and leads the Population Health Analytics Lab. Then we have Dr. Lisa Fan, University of Regina. Her research has been mainly focused on data science, machine learning, and its applications. She and her students have studied and investigated various machine learning and data mining algorithms and applied them to different data analysis, such as online educational data, traffic data, and health data. Dr. Maureen Anderson, University of Saskatchewan, is currently serving as the Chief Population Health Epidemiologist, Saskatchewan Ministry of Health, and Assistant Professor with the Department of Community Health and Epidemiology, University of Saskatchewan. Dr. Anderson is passionate about data for action to improve the health of the population of her home province of Saskatchewan. And then we move on to Dr. Nathaniel Osgood, University of Saskatchewan. His research is focused on providing cross-linked system simulation, mobile data collection, and theory-informed machine learning artificial intelligence tools, and applied category theory to inform decision-makings in public health. We have Dr. David Buckeridge from MD from McGill University. He holds a Tier 1 Canada Research Chair in Health Informatics and Data Science, and leads the Surveillance Lab and is the scientific lead of data management and analytics for the Canadian Immunity Task Force. And finally, we have University of Calgary's Dr. June Lee, Director of the Data Intelligence for Health Lab and Associate Professor of Health Data Science at Cummings School of Medicine, University of Calgary. His research applies data science, machine learning, artificial intelligence to a variety of problems in medicine and public health. So I'm just going to begin by covering what is our HRTP. So the HRTP came into existence through a funding call from the CIHR, the Canadian Institute for Health Research, and this is part of the Institute of Population and Public Health. The idea was to set up health research training platform pilot, which recognizes the need to support the development of research leaders of tomorrow by equipping trainees and early career researchers with the experience and skills needed to lead high-impact interdisciplinary health research careers in a rapidly evolving research landscape. So we are one of 13 HRTPs. HRTP is focused on building capacity in AI and big data skills for transformative change in addressing population and public health challenges and understanding how these tools impact health equity. Through our program, we expect to achieve the following outcomes. We're going to build AI and big data skills with the intent to support career trajectories across different sectors and disciplines. Train participants on how and when to leverage and apply AI tools to tackle persistent and complex public health challenges, and train participants on how to identify sources of inequity in data and data tools, and how to use AI to promote equity in health-related decision-making, programming, practice, and policy. Mission and approach. The mission is to establish a workforce of public health researchers and practitioners who develop and apply innovations in equitable artificial intelligence and machine learning. and to public health research, policy and practice in Canada. And the approach we're taking is to develop a suite of training activities and opportunities dedicated to facilitating the application of equitable AI applied to public health research, policy and practice. Our platform will focus on skills development and capacity building to apply AI and machine learning innovations to Canada's most pressing public health challenges that address the social, cultural and environmental determinants of health. The overall program goal is to establish a workforce of public health researchers and practitioners who develop and apply innovations in equitable artificial intelligence and machine learning to public health research, policy, and practice in Canada. The program elements are thus: we have scholarships to which we hope you will apply, internships, short courses and a certificate program. We also run workshops, and we have our Summer Institute, which is now on its 3rd year. Here are the partners that have joined us in this program. So the university partners are the institutions to which our mentors are affiliated, and those you will see on the left side of this slide. For our public health partners, they are Public Health Agency of Canada, CAMH, Public Health Ontario, Institut National de Santé Publique Québec, CDC BC Centre for Disease Control, the Edwin Long Centre for Healthy Children at the University of Toronto, Women's College, Ottawa Hospital Research Institute, and CanPath. We also have a number of AI data partners: CFAR, AMI, Health Data Research Network Canada, Statistics Canada, Mila, Vector, ICES, Canoe, Ivado, and the Centre for Health Innovation at the George and Fahey Centre at the University of Manitoba. So the bit that you're most interested in, I'm sure, is how the scholarship program works. So it is the intent to support trainee projects aligned to the goals of the AI for Public Health HRTB and provide supervision of Master's, PhD and Dr. PH. A postdoc and postdoctoral fellows by named AI for Public Health mentors who span disciplinary areas of public health, computer science, biostatistics, equity, policy and ethics. We aim to empower trainees in both research and applied public health settings with the knowledge to understand the role of AI and the skills to apply AI methods to real public health issues in different contexts. So we'll just now go over the eligibility criteria, but the most candidates need to meet the following criteria at the time of submission. So in the first place, we strongly commit to equity and diversity and encourage applications from racialized persons, persons of color, women, Indigenous people, persons living with disabilities, 2S LGBTQ+ persons, and others who may contribute to the further diversification of scholarship in the area of AI and public health. For those who are applying who are in PhD, Dr. PH or MSc programs, trainees must be registered by fall 2023 in a full-time graduate program for the duration of the scholarship at a Canadian academic institution. For postdoctoral trainees, they must complete all PhD degree requirements by the start of the award and registered as a postdoctoral trainee at the time of the award. And again, that needs to be at a Canadian academic institution or eligible institution. The way that the application will work is you will be asked a number of questions, and these will demonstrate, in the first instance, a strong record of research and academic excellence commensurate with your career stage. Applicants' research and proposed project will clearly demonstrate scientific rigor and clearly articulate research skills and assets, alignment with the mission of the AI for Public Health training platform, including relevance to public health systems partners, and strong equity considerations. They must be in the first, second, or third year, if applicable, of their program or fellowship. Applicants also need to describe their commitment to equity, diversity, accessibility, and inclusion in their academic or research work. Applicants need to articulate the challenges that they may face in engaging people with experience in their research, e.g. in the design, data collection, dissemination, and actions they plan to take to overcome them. This is the first year that we've introduced these questions, and you will find resources on our website which will help you answer some of these questions. Another important part of eligibility is that you have to be supervised or co-supervised by an AI for Public Health mentor. If you go to our website and you have a look at our About page, you will see a list of our 47 mentors and their biographies. The supervisor should have an area of expertise that aligns with the trainee's proposed research and the goals of the AI for Public Health HRTP, a clear plan to integrate the trainee into their existing professional and academic works, and be based and can hold funds at a Canadian academic institution and permitted to supervise a trainee. We encourage co-supervision of committee members from a complementary discipline covering AI, public health, equity, and ethics. The value and the duration of the scholarship. The founding amounts vary depending on whether you already have funding from a major, from the Tri-Council. So these are NSERC, CIHR, or SSHRC graduate awards. For postdoctoral award holders, if they have a CIHR grant, they will either get a top up, and if not, the full amount is 20,000 Canadian dollars. For doctoral candidates, the top up is 90, but if they don't have Tri-Council funding, is 20,000. For master's students, it's 15,000 or 6,000 as a top up, and the funding is for 1 year. However, we do encourage successful award holders to apply for a second or third year. So the expectations and deliverables, we expect award holders to engage with faculty members and other trainees through AI for Public Health events. They will be invited to present at the annual capacity building workshop and webinars throughout the year, and also to join and participate in the AI for Public Health Slack workspace, which is the way that we communicate. You also need to acknowledge funding from AI for Public Health in all related publications and presentations. There's an interim and final report. There are interim reports and final reports summarizing trainee research and providing metrics on products that were created during the scholarship funding year, i.e. Publications or presentations. And we also ask that they commit to becoming an AI for Public Health alumni and engage in alumni activities, including mentorship and networking with future funded trainees. So how will we evaluate those questions? Well, in the first instance, we're going to be looking at the quality of the research proposal and the public health impact. The second is that we would look to see how well they align with the goals of the program. And again, all the information about our program can be found on our website, so you can reference these when you're doing your application. We look at the quality of the training environment. So this is your supervision and the institution to which that you'll be hosted. Your commitment to equity, diversity, accessibility, and inclusion in your research, and also how you engage with people with lived or living experience in your research. So how to apply? Well, tomorrow we will be opening up our application form, and the application form will be open from June the 1st until the 30th. Applications will close on June 30th, 11:59 p.m. EST. When you go to the website, you can find the page by looking at traineeships and then under the scholarship page. And on that page, you will also find additional resources to help you with the application. So I'm just going to walk you through our current year of scholars to give you an idea of what kind of projects were successful last year. So starting from left to right, we have Joy Krishna Sharkar. His research is machine learning methods for automated mapping of different versions of the International Classification of Disease Coding Systems. Esther Davies is working on Black women's health and new technologies for fertility care. Joseph Donia has working on a design ethics case study. Jason Black, can we make better predictions about disease risk using artificial intelligence? Calvin Yip, understanding, predicting and preventing deaths of despair in Canada. Anasu Kundu, determinants of vaping cessation among youth e-cigarette users. Erin Collins, modeling of post-COVID-19. Under, oh, someone's, could everyone go on mute, please? Thank you. Anasu, determinants of vaping cessation among youth e-cigarette users. Erin Collins, modeling of post-COVID-19 conditions using Canadian data. Dr. Shaina Raza, utilizing AI to reduce health disparities and promote equity among marginalized population in a post-COVID-19 era. Xingyang Fen, prediction models for tooth loss. Mohammed Ahmadinejad, automatic cyberbullying detection using AI. Carolyn Quinlan, exploring the ethical challenges in the design and auditing of a machine learning computer vision algorithm for clinical use. and Dr. Hiroshi Mamiya, an AI algorithm to translate wearable device signals in physical activity information. So I do recommend that you take a look on our website. You can actually look at the scholars and look at their projects, and that will give you an idea of the diversity and some of the themes. But the most important thing is that it aligns with the goals of our project and our program. So we're looking for public health research problems. So thank you for coming and joining us today. If you want to get in touch, you can email us at our web email address, which is ai4ph.dlsph@utoronto.ca. I recommend that you follow us on Twitter if you're on Twitter, because we will make any announcements there. And we're also on LinkedIn if you are on LinkedIn.